abortion, which is frequently in the news. Many Americans think they are well informed on the issue. In reality, the education we've received through news clips and stories of protesters has obscured the truth. This tape will provide you with the medical facts of abortion. Let's begin by going over some of the terms that we will be using. The phrase products of conception refers to the fetus, the placenta, the amniotic sac, and the umbilical cord. The placenta supplies nourishment and oxygen to the fetus as well as removes waste. The amniotic sac is full of fluid surrounding the fetus. When women in labor say their water breaks, they're referring to the amniotic sac. The umbilical cord is a series of tubes from the placenta passing through the amniotic sac to the fetus. All of these products of conception develop in an organ located between the woman's hips called the uterus. This is a muscle-like pouch, about the size of the woman's fist. It expands as the pregnancy develops. The inside surface of the uterus is called the uterine wall. It forms a cavity where the placenta, amniotic sac, and fetus grow. The opening at the base of the uterus is called the cervix and is at the top of the vagina. The cervix is surrounded by muscle that is stretched or dilated to allow the products of conception to pass out of the uterus. Pregnancy is divided into 3 time periods called trimesters, which are about 3 months each. The medical facts of abortion will be explained by Carol Everett, Vice President of Life Network in Dallas. Carol owned and operated abortion clinics for over 6 years. Although in the past she actively marketed abortion, currently she speaks out against it and champions the cause of unborn babies. And now, here is Carol Everett.
Hello. I'm glad you joined us for this inside look at abortion. You will not be subjected to any graphic video footage of abortion or surgery, no aborted babies. Our purpose is not to shock or intimidate, but to inform. By drawing on my past experience as an abortion clinic operator and using the technological miracle of ultrasound, I hope to provide you with a clear and accurate picture of what happens behind the closed doors of the abortion industry. An abortion is the surgical destruction and removal of a living baby from the mother's womb. Methods are as varied as the stages of fetal development. Let's begin by looking at the first trimester of pregnancy. At this stage, the mother will have missed 1, maybe 2 periods. The baby's heart is already beating after only 21 days. The untrained eye will detect very little that's familiar except perhaps the tiny heart, which you see on this sonogram pumping life throughout the child's body. The baby's body is soft and pliable, so an abortionist can easily bend bones and tear muscle tissue. Approximately 90% of abortions are performed in the first trimester. The abortion procedure used most often during the first trimester is the vacuum suction method because of the softness of the baby's bones and muscles. This allows them to be torn into tiny pieces and removed by the powerful vacuum suction. Here's how it works. First, the abortionist dilates or enlarges the muscle-like mouth of the uterus called the cervix using a pencil-like dilator. He uses a small tool, then a larger tool, then moves to a larger yet tool, a larger yet tool, finally ending with a dilator that will be the size of the cannula. Next, he inserts the cannula, a hollow tube about 8 inches long. This has a curved edge designed not to perforate the top of the uterus. As the abortionist guides the cannula along the inside wall of the uterus, its knife-like tip disrupts the securely anchored baby, pulling and scraping her from the wall. The cannula then suctions the child, sometimes whole, but most often in pieces, out of the womb through the tube and into the collection bottle. The abortionist continues to scrape the uterus, watching the transparent tube to make certain he's getting all the parts, including the placenta, the sac that forms on the wall of the uterus and provides nourishment for the baby during the pregnancy. When the abortionist and his assistant, who have been observing the collection bottle, agree that all the parts have been removed, the cannula is withdrawn from the womb. In addition to the cruel dismemberment of the baby, the vacuum suction method also poses some risk for the mother. The cannula, though curved at the top, can still puncture the uterus if handled improperly. Women also run the risk of post-surgical infection. The dilation and curettage, or D&C method of abortion, works most effectively in the early part of the second trimester, about 13 to 14 weeks, when the baby's stronger muscles and bones are less likely to break apart with suction alone. In the D&C method, a curette, a sharp cutting tool, is inserted into the uterus after suctioning to cut up any part of the baby missed by the vacuum. By the time the baby is well into the second trimester of development, she's roughly this size. The mother might feel her move for the first time at about 16 weeks. Her eyes, ears, nose are formed. Her tender scalp has begun to sprout hair. The abortionist's grisly task becomes more difficult at this stage. The baby's bones and muscles, much stronger and advanced, are more resistant to cutting and suctioning. That's why the saline injection or salt poisoning method of abortion was introduced. At about 20 weeks, the baby begins to actively swallow the amniotic fluid that surrounds and cushions her in the womb. With a long needle, the doctor actually injects the salt solution into the amniotic sac, knowing that the baby will ingest it along with the amniotic fluid. The baby inhales the solution and dies, usually within 2 hours. The baby dies from suffocation, dehydration, brain hemorrhages, or convulsions. And yes, the salt solution often burns the baby's skin. Pitocin, a labor-inducing drug, is given to the mother and causes her to enter labor and deliver a dead child within 24 to 48 hours. Similar to the saline injection method, the prostaglandin abortion uses a hormone-like compound called prostaglandin, which is injected into the uterus, causing it to contract and push out the baby prematurely. The saline and prostaglandin methods might be the hardest for the mother to cope with emotionally. Many women tell how they felt the baby struggle within them for hours before dying. Also, the mother goes through labor and delivery, but hears no sounds when the lifeless child emerges. In some cases, however, the saline abortion was unsuccessful and the mother delivered a living baby. Several abortion survivors grew up to join the ranks of the pro-life movement. The possibility of a live birth represents some real problems for abortionists. How do you explain to a mother that she delivered a crying newborn instead of fetal tissue? Needless to say, abortionists have moved away from the saline and prostaglandin methods. RU-486 is a two-drug abortion technique used to abort a woman 5 to 9 weeks pregnant. It kills an unborn baby whose heart has started to beat. It can deform a baby who survives the abortion attempt. It has killed and injured women. Some of the complications include nausea, vomiting, pain, extensive bleeding, and even heart attack. But the worst complication may be the fact that the woman sees the baby she aborted. In France, RU-486 requires 4 visits to the abortion facility for the 2 powerful hormones to be given over a 10-day period. It costs more, or at least as much, as the surgical abortion. The RU-486 consent form requires that if the chemical abortion does not work, the woman will immediately have a surgical abortion for a second fee. The abortion clinics can charge the woman for 2 abortion procedures, RU-486 and the surgical abortion. In the late 1970s, the dilation and evacuation, or D&E method of abortion, was developed for more efficient killing in the second and third trimesters. Again, the baby's muscles and bones are too strong now for removal by mere suction or scraping, so in the D&E method, the abortionist crushes and dismembers the baby with forceps. As in previous procedures, the abortionist must first dilate the cervix to create an opening large enough for the forceps to invade. Dilation is accomplished either forcefully with surgical dilators or over a 2 or 3 day period by inserting laminaria into the cervix. Laminaria, bits of compressed seaweed that look like matchsticks, are inserted into the cervix. Gauze sponges soaked in sterile liquid are packed around the laminaria. The mother is sent home and returns the next day. By then, the laminaria have absorbed the moisture, caused the cervix to dilate. In the third trimester, dilation may take longer, maybe 2 days. Once dilation occurs, the abortionist uses the suction to break the water sac and drain the amniotic fluid. This time, he uses a much larger suction tip. And now, using the special forceps called bare ovum forceps, he then crushes the baby inside the womb and removes it piece by piece. Arms, legs, and then the body, and last the head. Since the head is always the most difficult part to remove, the brain is usually suctioned out using the cannula, the skull crushed, and the head is then removed. Using a technique called the Hansen maneuver, an assistant to the abortionist holds the top of the uterus, the fundus, to feel for the body parts that still must be extracted. This technician guides the abortionist to the feet, the buttocks, the head, and pushes the baby down into the instruments. During the D&E procedure, the abortionist and his assistants reconstruct the baby and count all the parts to be sure all the parts have been removed, because a part left in the mother's womb can cause an infection. Suction removes the remaining placenta, small body parts, and blood. The D&E, like other procedures, presents some very real dangers to the woman. Severe blood loss can occur. The uterus